not just about a concept of compassion or love, it's actually a reality.
Sometimes we are speaking the same concept, right? The same feel, the same emotions, but we use different languages.
Most people, again, are coming to work because they're looking for something bigger than themselves. We want these values to become deeply embedded into who we are.
Uh, Hello, Dr. Gupta. Thank you and welcome to the show, and thank you for joining us today. How are you doing today?
I'm doing well. Thank you, Shiva. It's such a pleasure to be here, and thanks for inviting me to be on this show.
Oh, such a pleasure from my side too. So, we would like to start off with if you could tell us a little more about your educational background.
Sure. Yes, going all the way back. Actually, I do like to start my journey back there because it's sort of that was the seed that was planted. I did my undergraduate in applied math and biology at Brown University, and then I did an MD at Brown University as well. It was part of an 8-year medical program, which is relevant because during the course of that 8-year medical program, it was a program in liberal medical education. They encouraged us to really explore other aspects that we may not have explored prior to coming into the program. So as a result, I got to try out community health and public health. And that interest gradually grew to a point where I wound up taking a year off between third and fourth year of medical school. And I did a master's in public health at Harvard School of Public Health. And as soon as I did that degree, the MPH, that's when the lights really started going on for me. And I started, getting really interested in all the concepts around evidence-based care and disease management, systems-based care. I'd never really been exposed to that previously in any substantial way. But as soon as I finished my degree, I really knew that that's kind of where I wanted my career to go. So I'm glad you started, the questions there because for me that MPH was really pivotal. And of course, getting the MD was really great. It allowed me to be a clinician, which I've been for now, the last 30 years. I practiced part-time as an administrator. And, all along, I think having the clinical experience allowed me to really understand what was working and what wasn't working. And then having the public health mindset allowed me to help, think about how to make those things work a little bit better.
That's wonderful. I think that's a conglomeration of both the clinical aspects and the administrative aspects, and also probably the public health and the community aspects that you have embarked early
Yeah.
on in your journey, seems like. So,
Mhm.
I know you already touched a little bit about the clinician aspects of your work, but earlier in the career, what was all the work that you were doing to lead?
Yeah. Well, pretty much out of the get-go, I mean, I did an internal medicine residency at the Digital Deaconess in Boston. And even that residency, I kind of sought out because I wanted to go to a place that would allow me to do some kind of an administrative rotation. There were a few places that they would, and then when I matched at Beth Israel, I had to remind them, hey, I don't want to do the standard infectious disease gastroenterology. I want to do an administrative rotation. So they said, okay, yeah, I remember that from the interview process. I guess you're serious. If you can find a mentor to guide you, then we'll let you do it. So then I promptly set about going and meeting a bunch of leaders. And I happened to find the director of the heme pathology lab who was doing a project in blood bank utilization by residents. And so that was my very first administrative project that I got involved with as a resident. So just telling you that story to share with you kind of how deeply the clinical and the administrative are always linked.
Yeah.
Right out of residency, my first job was as a associate medical director for disease management for the Dr. Deaconess Physicians Organization because my chief of medicine and program director saw the interest that I had in this administrative staff, and they approached me and said, hey, we're starting up something new. It's called the Physicians Organization. We're not exactly sure all the things that need to be done, but you seem to have an interest in the data and in working with doctors and trying to change practice patterns. So would you be interested in working with us? So it's kind of like an internal consulting request. So I said, of course, yeah, I'd be happy to. So I did that part-time, and I did part-time. I was a hospitalist way back in 1997 when the whole movement was starting. And so I was kind of always doing both, simultaneously. That wound up then growing into, I continued doing some hospitalist work for some time, but I was continued to grow my administrative interest as well. So eventually I wound up becoming a medical director for a hospitalist program and clinical work in that program on the side. And then eventually I wound up becoming chief medical officer at a couple of different hospitals, community hospitals in the Boston region. Which just gave me an opportunity to keep developing my interest and expertise in quality improvement, performance improvement. How do we figure out what's not working? How do we fix it? And then gradually, after those couple of stints, I said, well, where could I just do more and more of this quality improvement work? And the answer that came to me was consulting. So then I got into consulting about 12 years ago, and I've worked now with 3 different consulting firms: FDI Consulting, Navigate, which became Guidehouse, and most recently Premier. And the work of consulting is, for me, because of my clinical background, is all about clinical performance improvement. So many of the audience members, will probably, resonate with this. But looking at the kinds of outcomes we're trying to get on the clinical side, what are we not getting, and then how do we fix it? So we tend to do a lot of work in length of stay, throughput, clinical variation, mortality, readmissions, and all that kind of space.
That's awesome. I think so. You actually made my job very easy. Actually, those were some of the next questions that I wanted to ask, but you
Sure.
went dive into went
Keeping
deep.
up the pace with them. That's great.
That's great. All right. What is the work that you're doing at this moment of time? What's
Yes.
happening in a couple of years, and what are you doing now?
Yeah, that's awesome. Thank you for asking that question. I guess I feel like the question you've already asked, you set the foundation for this. So I was doing all this performance improvement work, quality improvement, and and such. Over the last decade, I kind of got deeper into more of the culture transformation side, which means that a kind of a substratum below performance improvement was this area of, if we start to address how physicians are engaged, if we start to address decision making, communication, accountability, then our work is more likely to become stable and durable. So we started adding this cultural transformation aspect to our work, and actually we did find that it led to many more successful projects and several projects that were still standing even years afterwards. So that was a great innovation for us. Then gradually what happened is, over the course of COVID, around 2020, I had a little bit of a wake-up call, because I felt that if I was doing such a good job on the improvement side and on the transformation side, then why were our people burning out like crazy? That really threw me for a loop, because that's all we were hearing about. Doctors have been burning out for a long time, and we really haven't paid enough attention to it. And then suddenly in COVID, we started hearing about nurses burning out, and now everybody was worried, because nurses are the essence of the medical workforce. And if you don't have enough nurses, then you can't staff your units. You can't keep your emergency room open. You can't keep your units open. You can't operate. So that really made everyone worried. And for a variety of reasons, they were leaving the workforce and burning out. So I said, well, this doesn't make any sense. Isn't it even possible that maybe the work we're doing in consulting is actually contributing to the problem? Because we think we're doing a great job by coming up with all these great ideas and creating benchmarks and standards, but maybe the people are struggling with keeping up with those benchmarks and standards. So it really threw me for a loop, and that I can't be the only one who's asking this question and has found an answer. So let me try to research this and see what we can come up with. So kind of got deep into looking at burnout and what other people were doing with burnout. And it took a few years. But then finally in June of 2023, myself and a colleague of mine who were collaborating on a presentation, his name is Tom Dahlberg, who's a mentor and a friend and a colleague to me. He and I started, we're preparing for a presentation, and as we were doing the research, we kind of chanced upon a few organizations that seemed to be doing something differently. There were 3 or 4 of them. They were just doing their own thing. They weren't really connecting with others. They weren't sharing notes or anything that we know of. But what they were doing seemed to be remarkable because they seemed to be just taking better care of their own people. And in that process, their people were reporting more meaning and purpose and joy in their work, and therefore more willingness to be engaged in the work, and actually therefore more willing to be collaborative. And that was leading to amazing outcomes across the board. So they were getting better quality outcomes, better patient safety, better patient experience, even better profitability, not at the expense of their people. So their burnout rates and their turnover rates were down. So this kind of is like the quintuple aim that we often talk about in the quality improvement population health circles. But I hadn't really found any organization that was hitting it out of the park on all of these fronts. So that was kind of remarkable. That made us pay attention. And frankly, the way that these organizations were just taking care of their people, it felt to us like love. So we started calling that work Loving Organization, just to put some nomenclature and framing around it so that we could go back and talk about it and go back and talk to the people that were doing the work about it. And when we did so, we went back to those role model organizations and said, hey, this great work you're doing, it strikes us as a loving organization, and that's what we're calling it. And we've identified 3 or 4 others that are doing something similar. It seems to be pretty remarkable and getting great outcomes across the board. They were all taken aback. They said, this is amazing. We had no idea other people were doing anything like this. We love it. We were just following our own, doing our own thing. We weren't following any particular playbook, and we had no idea others were doing anything either. But what you're describing, it sounds very much like what we're doing. Even if we didn't call it love ourselves, we might have called it culture of excellence or culture of caring. At the essence of it, what you're describing is very much what we're doing. And so we'd love to support you in some way. We'd love to work with you. So right then and there, we knew we were onto something. It was June 2023, because we were just being consultants, observing the leaders and the experts. We were not doing the work ourselves. But in the process of observing the experts, when we went back to them and shared what we had found, just by some simple nomenclature and languaging and some methodologies and concepts we were coming up with, they were all really interested and wanted to learn more. So we said, well, we're onto something. Let's make something out of this.
Mm-hmm.
And from there, almost everybody we're speaking to outside, inside the company I was working with, the premier, outside the company I was working with, everybody said, hey, what is the thing you're doing and how can we work with you? So we realized we needed to create a nonprofit organization. We call it a Loving Organization Consortium, so that everybody could participate wherever they were coming from and not have to worry about who owns what and intellectual property and such. And so we then formally launched that nonprofit in December of 2024. And then just now in November of 2025, we got our 501c3 designation from the IRS. So it's been now over the last 2.5 years, as you asked the question, that's really working on this loving organization idea and trying to help build that out.
Got it. Awesome. That was a beautiful journey and story, and how things actually came together and the process of evolution, right? Right. Get go from your interest in masters on public health to administrative and the quality improvement, safety, and how you finally landed up with the Loving Organization Consortium. That's a beautiful story. I do want to, primarily, I think we are looking at also compassion in healthcare. The primary goal or the aim of this podcast is to bring in that awareness about compassion and how can it strategically be used. And if I say compassion, I already heard that probably you said these organizations were caring for the people, right? And it was expressed in different terminology and different phrases, and you felt it as love, right? Love at organization. But if I say compassion, how does that sound to you, and what does that feel like in action to you?
Yeah.
And I also have a few more questions stemming back to the care of the organizations. But yeah, how does compassion, when I say compassion, what comes to your brain?
Yeah, well, a lot of things come to my brain. We have a lot of experts within our consortium who are experts in compassion. Panta Vahidi specifically comes to mind. She runs something called the Compassion Circles and Compassion Cafe. and is building out something really big in that space. What really I like her definition of compassion, which is really empathy in action. Empathy is the ability that we have to sense and feel what someone is going through, and to feel that we're able to relate to what they're experiencing. And then compassion is the ability to then take some kind of action, either help them understand what's happening, or to be present for them, or potentially problem solve for them, or something else that we might decide to do. So I think these are all related terms: empathy, compassion, love, kindness, respect, trust, kindness. There's many variations of it. I think they're all connected, related terms. It's going to be hard to talk about one without referring to another. Because if you look at a pure definition, you really not be able to define something. Even if you define compassion, it'll at some point refer back to empathy or caring. So from a language perspective, I think they're all connected. I think compassion is extremely helpful, as is empathy. We decided to go down the loving pathway, and maybe that'll be a different question that you'll ask, or if you're interested, for various reasons. Otherwise, we are ourselves not saying to anybody that you have to stick with any particular language. We're happy to help people understand whatever language it is that they're choosing to use. Anything in this human values, human system spaces, as we call it, whatever it is that appeals to an individual, and particularly to an organization, we just want them to understand what those human values are. They usually have them in their mission, vision, values, purpose statement somewhere. It might be compassion, it could be respect, it could be kindness, it could be trust. They have them somewhere, but what then usually winds up being a challenge is figuring out how to operationalize them. How do we bring them into the day to day? How do we connect those values to the values that all of our people have? So this isn't just a statement that's on the website or on the wall. And then how do we embody those values? And then how do we build systems around those values? So that's, I think, the main point we're trying to make with our loving organization work, is that we need to call it something. So we choose to call it love. And again, we'll dig into that terminology if you like. We recognize the importance and the criticality of all these other connected values, and they're just as important. And ultimately, we try to get beyond the language by just helping people understand. Use whatever language appeals to you, but let us talk more about how will we actually bring this into the day-to-day practice rather than get stuck in the language.
Got it. That is beautiful. Yeah, that is so true. I think I commonly come across this as well. Sometimes we are speaking the same concept, right? The same feel, the same emotions, but we use different languages. And sometimes just using that language differently probably can feel that we're doing different things, but the base and the heart, it's the similar or the same thing that both parties are probably talking about. So going back, I would want to learn a little bit more about the care. You said you found this few, 3 or 4 organizations that are caring for the people, right? And looking at probably those are the strategies we are trying to implement and operationalize all these trust, kindness, empathy, compassion, love, right? But when you said the organizations were caring for those people, can you elaborate on what that care looked like and how can we visualize that care, the love, the compassion at an organizational level, and what are the practical aspects of taking them forward?
Yeah, that's a very heavy and important question for us to unpack, and it may take a few rounds of questions for us to really get to unpack it. I love that you're thinking that way. Um, you know, Probably what I will say, maybe to start off, is that when in June 23 we had identified 3 or 4 loving organization role models, now we're up to 18. So the number is growing. There's a good number of them. It's not hundreds or thousands, but we know that there's more out there finding out about them. And they're all in healthcare and all in the U.S. Even though our movement is not explicitly focused on healthcare, we do have people within our consortium who are experts in education, 12, university, education, as well as IT, as well as banking. So we span many sectors, and because those individuals indicate to us that the needs are just as intense throughout other industries as they are in healthcare. And we also have members that are throughout the world. We have people in the UK, in Canada, in New Zealand, in India. So it's not just a US phenomenon. Now, be that as it may, it just so happens that the exemplars we've identified so far all happen to be in the US and in healthcare, all 18. And we put a lot of stock in the exemplars because then it's not just about a concept of compassion or love, it's actually a reality. These are people that are actually doing it, they're practicing it. Even if they don't call it that, they call it something else, they're still doing this brand of management that we call loving organization. And so we put a lot of stock in it. Our whole purpose within our consortium is to learn more about them, identify them, put the spotlight on them. It's not about us, it's about them. Do podcasts with them, case studies, articles, get the message out about them because we want people to learn about them. You know, they're the ones that are doing the work and they're the ones that are showing us that it's really possible to do this work. Now, that's a little bit more of the background of context.
Mhm.
What that brings us to is that we have been studying those exemplars in terms of what are they doing to be caring, as you said. All of them have actually taken the responsibility to be caring at the organizational level rather than putting it on the backs of the doctors and nurses, which is a really critical distinction that we found consistently. So it's an organizational level approach, and they do that by leveraging systems. So now let's unpack that a little bit more because most people don't understand systems. Again, by studying these organizations, what we've identified, we reverse engineered, you can say as a good consultant, we reverse engineer the methodology. We call it integrate, and technically we call it the integrate operating system. And that integrate is a mnemonic that stands for the 9 systems of any organization. So there's 4 people-based systems, that's leadership, teams, community, and the staff themselves. And then there's 5 process-based systems, that's management, technology, culture, workflows, and policies. So when you put these 9 systems together, that's what constitutes any and every organization. It's not just about healthcare. Just that in the default state, most of us who are not used to thinking about systems don't see the system, so we don't realize that they're there. We don't realize what they are. We don't realize we can leverage them. And in the default state, these systems are mostly being operated through fear because that's the prevalent management paradigm in our organizations and in our society. We manage each other through fear. We manage our spouses and our kids through fear. We manage, our in educational settings, we manage through fear. And we just don't even realize it. And that's the top-down, command and control, patriarchal, hierarchical sort of ways of managing that we just think this is the way it is. It's all we've learned. This is how we've been educated and how we've been acculturated and how we've been socialized. All of those things, unfortunately, create fear. And when you operate systems with fear, then you get fear as an outcome. So that's how you get loneliness and burnout and depression and anxiety that are resulting in the organizational context by operating these systems with fear. Again, all of this was what we're really learning from the exemplars. We've brought out some of this theory around it to kind of help support what it is that they're doing and to give it some understanding and some structure. But essentially, the exemplars are the ones that now are showing us that it's very possible to operate all of these 9 systems with love. You could have loving policies, workflows, loving leadership, loving management. Each and every level of integrate that we talked about could either be fear-based or love-based. And that's not, just a kind of a flip the switch kind of thing. You're either loving or fear-based. Of course, that's too simplistic. There's gradations of fear and gradations of love. The point is that all of these systems can be made to be more loving, so we can kind of go towards that goal. And that's essentially the real answer to your question is like, what did these organizations do? Once they took the responsibility at the organizational level rather than put it on the back of the individual doctor and nurse to figure out how to be more loving or compassionate. Some of them have provided resources to help individuals become more loving and compassionate. There's nothing wrong with them. Those are great resources. I've used those resources. I know lots of colleagues that are developing and deploying those resources. I think they're great. The challenge is if we leave it there and think that that's it, our work is done. Let's just make sure we've made well-being resources available to clinicians. So now they have yoga, meditation, mindfulness, all sorts of techniques that are available to them. But what does that do to the individual? The individual doctor or nurse says, okay, great, you're giving me these resources, But now you're expecting me, the person who's almost burnt out and overwhelmed, you're telling me I have to find an hour out of my day to go for a walk, to take a break, and so it actually comes across, many of our clinicians have said it's like a slap in the face if you're telling me that's what you're going to do to try to make the environment better. Give me the resources, great. I will try to take advantage of them, great. But don't make it feel as if I'm the problem. And 50% of people burning out in healthcare, in every field now, every discipline, pharmacy, therapy, doctors, nurses, even leaders, everyone's burning out. 50% of people burning out is not because 50% of people have a problem. It's because together as an environment, we created a challenge that you need to resolve. So that form of caring, which is well-being and wellness, is important, but it's not sufficient. The kind of help which is more training, let's train people in compassion, let's train people in empathy. That's also important, but that also comes across as individual, deficit-based. I have a problem, Dr. Gupta. You've got to become a better, more compassionate. So it's helpful, and we all know that we can all get better in compassion or love. But again, it's not sufficient. The exemplars that we're talking about, 18, and that have helped us learn this integrate methodology and develop this methodology, are all taking actions at the organization level by infusing the systems with love and compassion and respect and trust, so that the overall environment becomes something within which each of us who are practicing in the environment can then be uplifted. It allows us to practice at a higher level. It allows us to see each other, support each other in practicing at a higher level. It allows us to see our leaders role modeling this kind of behavior, and that lifts all of us up in a way that just paying attention to the well-being, wellness, and training resources is not sufficient. So let me pause there because we said a lot. I hope that really answers your question, but if not, feel free to unpack it further.
Yeah, I think definitely. I hear all that and I see that how important it is at the level of organization and systems to bring in all that change. And I wouldn't say change, but probably let the love and the compassion do the work at the level of systems and organizations. But the question is, I've noticed that you've recognized some examples or exemplars over the course of the last couple of years. And but I wanted to see practically how can we put it out there, and if if there are organizations that want to adopt that model, how can we take it forward? Right?
Yeah.
What are the practical aspects of it that we can implement? What are the examples or what are the stories that you can tell us that we can relate in, especially the other organizations which are not in that path at this moment, probably in the patriarchal or the hierarchical model? How could they adapt and what are the practical ways of changing towards?
Sure. Yeah, another fantastic function which kind of lead to continuing down this path that we're already on. So now you know that we developed this integrated model. We have learned about it from the exemplars and our own experience also, just kind of being consultants and leaders in the space and just thinking about the space, we've identified these 9 systems. What we then did is from the 18, we developed best practices of what is it that they're doing. And then we have created a maturity model out of those best practices. These are the things that consultants do. If there's consultants and improvement experts in your audience, they'll recognize this. So we took all the best practices and we made them into a maturity model for each system. Leadership, 1 to 5. Here's the level of maturity that you would expect to see based on these best practices. So for every level of integrate, we've created best practices, and then we developed a assessment out of that maturity model. So that allows us to go in and compare any organization to these global best practices that we've identified. And now we've actually done that assessment on 7 out of the 18 organizations that were willing to do it. We actually ran that assessment with them, and they gave us tremendous feedback. Really positive. Love it. Love the model. Love integrate. Agree with your findings, our strengths. Agree with your findings of our challenges. And we also gave them recommendations for things they can do to get better. Plus, we can give them kind of a number rating on a scale of 1 to 5, so they can get a sense of where they are compared to the global best practices, right? They can get specific suggestions, they can understand their challenges, and they can get a number, from 1 to 5. So now that, if you're following that, that's kind of making all of this more practical, trying to make the whole thing more practical. It really ultimately works, from 1 to 5. So now that, if you're following that, that's kind of making all of this more practical, trying to make the whole thing more practical. It really ultimately boils down to best practices. You say, so what can we do? Best practices. If we were to be a test, usually the challenge is that we know what it is, we know what we want it to be, but not everybody, in the organization, understands what it is. And they really become cynical over time because they keep talking about it, so we don't really do it, embody.
Okay. Yeah. So operationalizing values is really is about first understanding what the organization's mission, vision, values, and purpose are, taking it off the shelf, off the homepage, and really understanding what are they, underlining all of them, try to pull out what already in the values speaks to human systems. We're not trying to change their values. We're simply trying to get them to connect more deeply to them. So we basically, do an exercise where we'll underline all the terminology that refers to any human values, human systems. They may be referring to things like trust, respect, kindness, compassion. Some might be using love already, although love is kind of, at the outer edge of probably where most people are operating right now.
Mhm.
Our job at that stage is to take it off the shelf, underline it, and then help people connect to it. We help the individuals understand what their personal values are, and then how do those personal values connect to the organizational values? Because that's a really critical process. Most people, again, are coming to work because they're looking for something bigger than themselves. They're looking for belonging. They're looking for meaning. They're looking for purpose. It may not be everybody, but there's a great majority of us that want that. This has been proven through all of the psychology research that's been done over many, many decades that humans need this to survive and to thrive, is they need a connection that's bigger than them. So if we don't give it to them, then they focus on the things that we give them, which might be the money, or it might be the compensation package, or it might be their schedule. People tend to focus on those and those practical things because they are important too, but if that's the only thing we give them, then they hyper obsess on them because that's all we've given them. So we really need to be able to give them a chance to connect to the organization's mission, vision, values. Those are a couple of initial steps. Then what we do is we take those values and convert them into behaviors. How are these values going to be actually evident on a day-to-day basis?
Mhm.
How are we going to know that we're living these values? So we convert those into behaviors, and then we train usually a small number of people. This is where I used the example earlier. I don't know if you caught that, but one of the best examples that I have of this is from Adventist Health Castle in Hawaii. They're one of the hospitals in the Adventist health system. They are a winner of the Baldrige Award from 2017. And they won that award largely on the basis of taking an internal campaign they had called Love Matters and really developing it into their culture. So they ultimately wound up developing, training their senior leaders on what does love matters means, and what are the values that need to be exhibited, what are the behaviors that need to be exhibited on a day-to-day basis. So they just trained a small number of people who were really already bought into this culture, and they made sure they knew how to display those values and behaviors. And then they created a mechanism to recognize when those values were being practiced, both by the senior leaders themselves as well as by other people that were then seeing them practice it, so they could call it out and say, "Oh, that's great. That was a great example of courage in action," or whatever their value may have been. And then they developed a reward mechanism that rewarded people based on those, seeing those values in action. So they developed a whole end-to-end mechanism of identifying what their core values were, creating behaviors around those values, training a small group of people to figure out how to exhibit those values, who could then become role models for the entire organization, and then creating a recognition mechanism so that when those values were being practiced, it would be evident and called out to people, so it would be underlined for them, and then creating a rewards mechanism so that further cemented the importance of these values. That's the end-to-end kind of values cascade that Adventist Health Council created, and that some of our exemplars work on, is understanding that it's not up to any given individual to exhibit the values. We don't want to create superheroes that are just, the values champions. We want these values to become deeply embedded into who we are. And so this is the way we do it, is by building it into our behaviors and bringing it into our day-to-day operations, doing the role modeling around it, and then making sure there's rewards and recognition mechanisms around it.
So we were talking about the practical aspects of how we can bring in this culture, right? Culture transformation. And you were also giving us examples about the strengths when they score about this best practices. You were also giving about the strengths that systems had and also the challenges. Can you can you elaborate on the strengths, give the details, or if we can tease out the practical aspects of it, that would be great.
Sure. Sure. Yeah. Thank you, Shiva. Yeah. So we talked about one of the systems, the culture system, and why that's so critical in terms of giving meaning and purpose to people, so that they have something to look forward to more than just making money. And then how do we actually bring that culture deeply into the organization? Some of the other best practices that we've learned about from these exemplars is one of my favorite ones is called Cascading Huddles.
Mhm.
That's something that's been implemented by Intermountain Health. They have at least the best, example of it that I've seen. They start with morning huddles on every single unit, on every single hospital. I think they have many, many hospitals out in the Utah area. And so it's just a standing huddle, nurses, maybe some of the doctors gathering around, talking about how the last 24 hours went, focusing on the priorities, patient safety or throughput or what have you, whatever their priorities may be. And then talking about any challenges they might anticipate in the next, 24 hours. And it's a standing huddle. It gives everyone a chance to talk. It gives everyone a chance to check in. It gives everyone a chance to know what the priorities are for the organization, to be able to create a space for safety so that people can talk openly. And then they cascade that huddle from the front line to the managers, directors, VPs, hospital presidents. And then by 1 p.m. every day, the system CEO is
Mhm.
finding out about, getting a summary from all the hospitals, all the units about what the big challenges are. So they have a big picture perspective and an individual picture perspective. And all the staff that are in this chain are all being connected through that communication cascade. So it's creating transparency, prioritization, safety, and an opportunity for communication. And now, if the CEO decides that they need to fix something, that can also be communicated through the chain. So it creates some element of bidirectionality as well, which is really important. It's not just people reporting out on their concerns, but they're also getting to hear what's being done about some of the challenges that are arising. So to me, that's a great communication system, and it's a great example of a way to implement a system that doesn't put the burden on any individual, right? Because no one individual or nurse, manager, leader, physician is expected to create any of this system. They're just expected to participate. And then in the participation, we get to teach everybody what it means, again, through role modeling. There may be some training components involved, but that's not the heavy issue. The issue is the creation of the system, the operation of the system, the role modeling from a few select leaders, and then the ability, for that daily operational system to then wind up creating the kind of culture in the hospital that you like. So that's one example I would share. Another example I'll share with you, and then can pause and see what other questions you have.
Mhm.
This is another favorite example of mine that comes from another one of our exemplars, Baylor, Scott and White. They have implemented a really high level of shared governance. This is a concept that many nurses are particularly used to, particularly those that are pursuing magnet designation. Often they talk about shared governance. Baylor, Scott and White has just taken it to the next level. I think they call it shared governance 2.0. It might even really be 3.0. They've
Mhm.
created something like 17 interdisciplinary councils that include the nurses, but also include other clinicians, pharmacy, therapy, and now they're starting to include doctors. So the point of shared governance is to get people on the front lines to be included in the decision-making process. Now, you can't include everybody, but you can include some of the people that are trying to represent the perspectives of their colleagues on the front lines. That's a great way to create autonomy, ownership, buy-in, engagement, a feeling that we're all in this together. It's not just a bunch of directors or VPs that are coming up with some ideas and telling us what to do. The decisions are actually being informed by what really makes sense and what's practical for the front lines. So shared governance is another powerful example that I will lay out there. And these kind of come within either the leadership system or they can come within the management system. Again, we're not trying to create silos per se. We're just trying to get people to think first, what are the systems that we could leverage? And then what are some of the best practices that could be implemented in the systems? So hopefully that those three examples, shared governance, cascading huddles, and the ability to operationalize your values give you some ideas for how this can become practical.
Got it. So going back to the operationalizing the values, right? Can you, at the ground level, how do you see them and how do you operationalize them? And I know every system probably individualized to their own styles, right? But still, the behaviors cannot be different. It could be very similar. So I want to tease down if you've come across these behaviors that could be trained and what are the mechanisms that they found to actually operationalize this and also reward.
The people that you train really has to be dependent on the organization. I don't think there's a formula. At Adventist Health Castle, they focused only on the senior leaders. So there was a small group of about 7 to 8 people in the C suite because they felt that those leaders really were committed to the values and they really got them and they were committed to the Boulder journey. And they would be the best ones that, they could do a small focus group training and expect those people to then start role modeling the behaviors and everybody else starts looking up to them. Make sure that you are clear on what the behaviors are. You need to, you know, make sure that there's a small group of people that is, practicing those behaviors so that there's some role modeling component. And then you need to make sure that someone is then calling out when those behaviors are happening. It could be the senior leaders themselves, or it could be another group of people that are designated to actually lead that work. They might be a culture transformation work group or such that actually calls it out, or, a rewards and recognition group that calls it out. There are many different ways to kind of roll that out, and I guess, for our purposes, we tend to focus on the most core elements of that best practice so that, that really winds up serving as the inspiration for others. Right at this level, I think what we're trying to just understand is like get the big picture and get an understanding of what's been done enough so that, someone can say, oh, as a best practice, I would like to learn more. But is there still something in there that you think we need to dig into more deeply? Because I'm not sure what else I can add.
The behaviors, I actually would like to know what were the behaviors that
Well, yeah, that also it's hard to know because I mean, the behaviors were dependent on them. It's how they role
that's right.
model being
So got
loving.
it. Yeah,
It's
got it.
Love,
Yeah.
Love
So
Matters was their campaign. It was not about compassion or respect or trust there. It was about love. And the behaviors they were following were really related more to how they show up on a day-to-day basis. But that, again, I would submit, Shiva, is really independent because we could all take the same value of compassion and maybe we want to exhibit it in a different
different.
way. For some people, it may be about how that compassion shows up in a patient interaction. For some people, it might be about the nurse-physician relationship. So, different people will still put an emphasis on different aspects of what that behavior needs to look like, which is again why just as much as we try not to get caught up in the language, we also try not to get too caught up in the too much of the detail because that individual detail will probably also not be really relevant
Or the
if
loving.
to an organization, right? It's more just kind of keeping it somewhere in the mid-level where we have enough of an understanding of what was done and enough of an inspiration to others that they could do it, and then an invitation to people to say, okay, well, let's get in the room together and start imagining this together. Like I could imagine you going to your organization and actually starting with this exercise. But the beauty of it would be to really take your leaders on that exercise rather than coming in with, pre-described behaviors that some other organization, right, really followed.
Yeah, I
Because
think
there's so many different ways to be loving or care or compassionate.
that is so true. Yes, I think it can be very individualized and probably it's very effective and we can co-create with the team that we will be actually putting out. We also talked about there were some barriers that they were coming across, these exemplars were coming across. So can you think of any barriers that they've noticed and
Yeah, well, actually, interestingly enough, I think probably the barriers are that there's no perfect loving organization.
Mhm.
Love is and loving and empathy and compassion is always a work in progress. It's very complex work we're doing, whether we're doing it in healthcare or in any other field. It's constantly changing. The people are constantly changing. The environment is constantly changing. So whatever systems we've created cannot just be static systems. They have to constantly be evolving and adaptive. And I think that when we talk to most loving organizations, even the ones that are the best of the best that are performing at the highest level, they always feel like there's more they could do with a certain group. If their efforts were led by physicians, then they would love to see more happening with the nurses, and vice versa. If they were nursing led organizations, then they would love to see more happening at the physicians level, right? So we still, unfortunately, even in loving organizations, still will find pockets that we're not able to get to, for whatever variety of reasons, right? Because it's still early in the journey. We're still trying to get wins. People aren't fully convinced or bought in that this is something important. It's, change management, 101 is like whatever it is, change that you're trying to bring will probably get resisted by people, even though you try to follow the best evidence and the best science about how to go about embarking on the change. Change takes time, and change is a long, long standing journey. We have within our exemplars, we have people that have been at it for 3 years. We have people that have been at it for maybe around 10 years. We have some that have been at it for decades and they're still on a journey. So I don't think it's ever quite complete. That's probably one of the biggest barriers is that there's always something to do. But I'll tell you, the loving organization exemplars kind of are always open to that. It's not, as disappointing and frustrating as it might get on some occasions. In general, they think of themselves in learning mode. They're always open to feedback, open to ideas, open to best practices. That's why so many organizations who were loving organizations agreed for us to do the rapid assessment with them because they wanted to learn from the best practices. So I think when you come to this work with an open, genuine curiosity, genuine interest in taking care of your people, and a genuine desire to learn, then along the course of the way, you'll find these barriers, but I think you'll be able to overcome them more quickly. The central tenet of it is still going to be the same, which is make sure your people are involved in the process, keep them engaged, make them part of the communication, make them part of the decision making, make them part of the strategy, get them involved as much as possible. So that communication mechanisms, the culture embodying practices we talked about, the shared governance mechanisms, they all become really, really critical.
That's great. That's good to know. So I think in terms of um, so we were talking about the patriarchal and the hierarchical models, and which are still out there and probably predominantly out there. Um, I mean, all these leaders have that pressure of financial metrics and wanting to do more, and probably there isn't enough understanding and recognition that probably aligning with ourselves or internally as well. And these concepts of love and caring for our people and being role models, right? Role modeling these behaviors will bring in a change and probably add to the financial gains, right? That is what I'm sensing, but I'm sure there are many organizations that have not recognized this yet. So what would I mean, can we say that have we seen this financial reaching these organizations reaching their financial metrics, doing well, and how are they doing financially? And I know we talked about the um, Baldrige, sorry, Baldrige Award. But financially, can we talk more about the financial metrics? But that, because I'm sure many of our leaders will be interested in that.
Yeah, that's a fantastic question. I'm glad you're bringing that up because I think just like we individuals need to make money, organizations need to make money. That's the
Mhm.
lifeblood. And so we definitely want to support organizations in making money and individuals in making money. We just don't want that to be the only thing they do. So it's kind of like about a balance. It's about bringing in all the other outcomes that an organization is also interested in. They need to deliver great quality, great safety, great patient experience, and not burn their people out in the process, right? So we're trying to bring much more of a holistic outcomes approach rather than a individual outcomes approach. We're certainly not saying sacrifice your profits for being loving. What we're saying is exactly what you're saying. If you actually go down this compassionate, loving, empathetic approach and just get more meaning, purpose, and joy within your team members, get them to be more engaged, you will find that in general that your turnover is less. That will lead to reduction in hiring costs. There's already been demonstrated widely in the literature, and actually nobody refutes this. The average nurse turnover is now estimated to be about $60,000, and the average physician turnover is more than $1 million. No one really refutes this, and everyone also understands that that turnover is partly due to poor engagement. So we all know that if we can get that greater engagement, because we can create these mechanisms and these human systems that create that engagement, then we should be able to reduce burnout, which will lead to turnover, reduce turnover, and which will lead to increased profitability. Now, all of the other outcomes also get better. So improvement in quality has also been demonstrated to lead to a reduction in costs. Improvement in patient satisfaction will also lead to improvement in revenues, because those are the people that will be talking about you in the community. That's your free marketing, word of mouth. That leads to greater volumes for the organization, which leads to greater revenues. So all of these outcomes are ultimately connected, and they need to ultimately all connect to making greater revenues. Our Loving Organization exemplars have certainly demonstrated that. But you posed the question, Shiva, in a very interesting way. So I just want to make sure we caveat it here. The level that we've been able to currently understand these 18 exemplars is at a fairly high level. We've talked to some of their leaders. They've stated publicly that they are a loving organization, or they resonate with that term, or they aspire to be a loving organization. Again, none of them are perfect, but they're on that journey. And they've shared with us verbally that that being loving has, led to some really great outcomes across the board. Better patient safety, better quality, better patient experience, better profitability, and reduced burnout. So they've shared that with us verbally. We've not gone inside any organization and independently validated what is their profitability or what is their burnout, right? We're not at that level yet. We'd love to be able to partner more with these organizations and actually go in and do more in-depth studying of it. Again, we're not at that point yet. So this is at a very high level, informational, based on interviews, and it's based on their own indication that they are seeing outcomes across the board. So I just want to make sure we caveat that. We can't just match up these 18 with another group of matched 18 and just say, oh, their profitability is better. We just don't have the data. We'd love to do it, but we're not at that stage in our journey as yet. Yet whatever stage we're at in our journey with whatever it is that we have learned about these 18 has been super inspiring to lots of people, including the 18 themselves, but also to other people to say, yeah, there's something in this here. Even if we don't have, like you were asking for more details on some things, we may not have all those details. We may not have all the details on the data, but what we do have has been is sufficient to get people excited and inspired and enthusiastic to want to continue on that journey. The exemplars themselves wanting to get better and to then inspire the next generation. Of course, it's still super early. When we think about the diffusion of innovation, we think we're at the innovator stage, which is very early. There's only going to be a very, very small number of people that are going to want to take this on at the organizational level. There may be pockets of this, departments or units or leaders that are already trying it out or more encouraged to try it out because they hear about it. But truly to take this on at the organizational level, we think it's only going to be a handful, maybe three, maybe four, maybe five. So we're not imagining, even though we've created a not-for-profit to support a social movement worldwide around this concept, we're not naive about it. We're not thinking this is going to sweep the world and that suddenly within a matter of months to years, we're all going to become loving and hopefully it happens. That's great. But that's not what we're imagining. We're planting the seeds, we're cultivating the process, and we're fully expecting that the number of people and number of organizations that really want to do this work is going to be a small, select handful that's going to be motivated because they already have one or two key leaders in place that already think of themselves this way, and now they would like to expand their leadership, into the organizational system space. I hope that helps to answer your question, Shiv.
Yeah, definitely, definitely.
Great.
Yeah, in terms of, where are we?
We just
On
have
the
10 minutes left. Is that right for you?
Yeah,
Okay.
that should be, yeah. Um, so going to the, I mean, I heard a lot about the professional journey, a loving organization, where you started and where you are right this moment, and probably in the very beginning of this or at the innovation stage of the loving organization. And I would love to see this grow, and I would love all the people to become loving very soon. But yes, do understand that it's going to take some time. It may take up to many years and possibly even decade to spread this beautiful work. But if somebody wants to reach you, where they could reach you, that's one question. I also want to know, would like to understand, was there any personal journey that you've had that led to this? And
Wow. 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 Well, that's now you're opening up a can of worms. I wish I had something stronger than coffee here, but no, but it's a really, really profound question. Maybe we'll have a chance to do another interview and talk more about it, but I will tell you a little bit about it so that we're not leaving you and the audience hanging. Yeah, I did have part of the personal journey was what I shared. It was this wake up moment while I was a consultant and a performance improvement and transformation expert. And I felt that maybe there was something missing because people were burning out. That's definitely a part of the personal journey. But then the deeper part of the personal journey also happened for me somewhere around 2016 or so. I started to kind of go through, I guess, what you'd call some sort of a spiritual process. Prior to that, in 2016, prior to that, I was really more like an atheist agnostic. I really didn't have a perspective on the universe or God or what have you. I would remember saying things like, I don't know if God exists, but if it does, then I don't know how it matters because how does it change my life? What am I going to do differently if God exists? So then, I'll choose to just keep doing the things that I can understand versus the things I can't understand. That was my atheist agnostic sort of perspective. But then, Shiva, in 2016, some things started happening to me that I just couldn't explain anymore. Like I had no words to explain it, and it was well beyond anything I understood. Prior to that, my life was all about math science and following a straight path and doing things that made sense and feeling like I was the active agent and, doing things. But then a number of things just started happening, like insights coming to me that I had no prior access to or exposure to, what we would call eternal wisdom, what we call in Hinduism, Sanatan Dharma, eternal, the eternal truth. But it was things like that that just started coming to me in some kind of a download that just continued for days at a time when it first started, that just made me feel like, wait, there's something completely different going on here. I've never experienced anything like this before. And I don't think I can explain any of this based on, actual material knowledge or access to information that I should have had or could have had. It was just coming to me from somewhere. And it was profound. And it was, as I was just, all I was doing was writing it down as it was coming, but I was reflecting on it. It really kind of started resonating with me. And then the more now I've learned about it in the last 10 years, I've realized that this is the eternal truth, because then I started studying it after a period of time. I started researching and reading books and in Hinduism and Buddhism and Islam and Christianity and Judaism. And it's like just everything I read at the spiritual level, they were all saying the same thing. I know at the religious level, we all think there's lots of differences in our practices and our behaviors, but at the spiritual level, they were all saying the same thing. And it was profound. It was like eye opening to me. It's like, how could all these different religions that seem to be at odds with each other, how can they all be saying the same thing? And how can it be consistent with these downloads that came to me before I even started reading any of it? So that was a bit of a personal transformation, I guess a lot of personal transformation journey that started for me then. And it just got deeper and deeper and deeper. So I guess I would now say that I'm now have accepted that there is some force that unites all of us, that we're all connected in some way beyond what we perceive, that we're not just our, mind and body that, makes us feel that we're separate beings, but that there's some, you may call it soul, or you may call it universe, or you may call it God. That is the essence of all of us that actually creates solidarity and a commonness for us. So that's part of that spiritual journey. And I think that spiritual journey is certainly part of what's coming into Loving Organization also. We don't talk about it too much because people already have some challenges with it. The love terminology, once you start talking about God and universe, then people get even more, because I think of the religious issues that people tend to think of. Again, at the spiritual level, I think a lot of people are in alignment with the thinking. It's just at the religious level where the differences come out. But when we really do reflect on it, for many of us who are in the Loving Organization movement, not all of us, but many of us, we think of it as a calling, and many of us are operating from a deeper place than our personal selves and our personal egos. That is this universal self. And One of the reasons why we feel that calling it love is important is because love is God and God is love. And we like to say that love is the best way for us to manifest our spirituality in the material world. That, hopefully it's not off-putting. The point isn't to proselytize and convert people and to scare people. It's mostly just to recognize solidarity and to derive our energy and creativity and our strengths from a deeper place than Apurv wants to do this. It's not a individual focused activity, it's a collective focused activity. So I think because we're trying to operate it from that deeper place, it allows us to harness more of that collective energy of the greater whole. So I don't know if that's what you had in mind.
Well, it is beautiful. It is beautiful. It resonates a lot, and I think that was very essential to understand. And now
Yeah.
see that, okay, once you understand that there is some force behind, and
Yes.
you said like how would make a difference? That's what we would thought was prior, but now if you're thinking like, okay, it's different, and all this is coming from a deep place. That's beautiful. I know we are kind of running out of time, but few rapid fire questions and last few questions.
Sure.
What is one love? What comes? One word for love. It's tough, but
Well, I just say God,
okay. Compassion,
empathy.
self compassion.
That's a tough one. One word for self-compassion. Acceptance,
Yep. Okay. I mean, and healing.
healing, forgiveness.
Got it. And one book. I mean, one would be tough, but book or a role model.
Well, the absolute one of the books that really got me on this personal transformation journey, at some point in the journey, I did talk about it, but I'm glad you're bringing it up, is Mindset by Carol Dweck. It talks about fixed mindset and growth mindset, and it's the one of the books that I credit for helping really open up my mind into thinking differently about what I am and who I am, and it's a psychology, but it really derives from spirituality when you read it carefully. And so, and it gives you some very practical ways of understanding how to implement changes in your life that really are operating at a deeper than psychological level. So Mindset by Carol Dweck.
Awesome. And what is one thing that you would do every day?
That I already do or would like to do.
Would do every day to keep that loving nature.
Well, I have a daily gratitude practice, which I've really appreciated. I think it started about a year and a half or 2 years ago. And it actually started because a friend of mine was going through some difficulty and I just wanted to help him. I couldn't be there for him. And I just said, "What would help you?" And he said, "I have a friend who shares with me what they're grateful for." And I said, "You know what? I can do that. And I'll do it every day. And if I share it with you, maybe I'll start sharing it with a few friends and family of mine." So I now have a small community of people that I share my daily gratitude with. And I think that that's something I wake up with every morning. It makes me reflect throughout the day what I'm grateful for. And I think it's something that really keeps me anchored in the ideas of love.
Awesome. I didn't have this question, but I have this. What is one thing that you want to practice
More of?
more than
Well, what people tell me that I should try to practice, which I've not yet practiced, so it's on my mind, is meditation. I don't have any formal meditation practice. I guess I feel like my day to day is kind of a meditative presence, but I don't have a formal like take 30 minutes out of my day and do meditation or even 15 minutes out of the day. So that's long been on my mind and something that I think about trying to bring into my daily routine.
I think you understood the beauty of the universe already, Apurv. So I don't know if you yeah, I don't know if you need additional meditation, but I think that's good way to strengthen our and yeah, ground ourselves continuously. That's awesome. I know I'm going to take a few more minutes. Any last small act that for our viewers that you could suggest to practice every day that we can start doing?
Yeah, well, I would say start thinking of what's happening to your life as a system, and start creating systems that allow you to bring whatever change it is you want to bring into your life. Don't just think of it as a personal thing or as an individual thing or as a mental thing or a psychological thing. Those are all kind of blocks that we have. Which actually leads me to another great book I would recommend. It's called The Power of Systems, co-authored by Steve Chandler and Trevor Tembeck. Is one of my most favorite books of recently, and they will help you to understand how to think in terms of systems.
I would like to have you back again sometime. I think there's a wealth more of information that I want to discuss.
Thank you.
But any parting message for our audience?
Well, I would say check out our movement at www.alovingorganization.org. See some of the case studies, learn more about us. If you're inspired, join the movement. We're looking for people who have this passion and have been looking for this kind of community and want to contribute to it. So that's, I guess, my parting thoughts. If you want to be in touch with me, LinkedIn is probably the best way. Dr. Apurv Gupta is usually the easiest way to find me. And I would love to connect with you and meet with you one-on-one and hear your ideas on how what you're working on and how we might be able to work together.
Awesome. Thank you. Thank you so much for being here. And thank you for all the wisdom and information about the loving organization and the exemplars and the strengths, challenges, and the examples. And thank you so much.
It's so kind of you, Shiva. You are an amazing host. You covered a huge amount of territory and you made me feel very welcome and really pulled all this amazing story out. So thank you so much. And I would love to be back as well and just continue this dialogue with you because you're thinking about this so deeply yourself. And we just love to, as you and I have been talking about, let's find ways to collaborate, hopefully.
Entirely. Yes. I would love to. Yeah. See you.
Awesome. All the best then. Thank you so much.
Thank
Take
you.
care.
Yeah.
Bye.